My name is Katie Dain, I'm the CEO of the NCD Alliance. The NCD Alliance is a global civil society network of 2,000 organisations in 170 countries, leading the charge to elevate NCDs onto the global health and development agenda. So my role in the WHO High-Level Commission on NCDs was as one of the few civil society representatives around the Commission. I was also on there as the co-chair of the WHO Civil Society Working Group on the UN High-Level Meeting on NCDs, which is an important grouping of civil society leaders working closely with WHO at global and regional levels to really mobilise heads of government and heads of state to attend the high-level meeting and to ensure the meeting is a real success in moving the NCD agenda forward. So overall, civil society received the High-Level Commission report in a positive light. We as the NCD Alliance convened the civil society organisations, over 230 organisations, to develop an official statement of response to the High-Level Commission report. In our statement that hopefully everyone at the meeting has seen, it really highlights some of the positives and some of the areas that we feel the Commission fell short at. The highlights for us were the importance of really elevating NCDs onto the highest political level, really calling out the importance of leadership and ownership of heads of government and heads of state in NCDs. Also, the High-Level Commission report provided a really useful focus on financing for NCDs, which has been one of the major Achilles heels in the NCD response over the years. Thirdly, we were really pleased to see a strong focus on civil society and meaningful involvement of people living with NCDs, as well as a focus on accountability, because we believe over the years this has been, again, a bit of a weakness in the response. Many commitments made, many targets, but not really seeing that translate down to national and regional implementation. So really, the High-Level Commission provided a useful focus on the need to strengthen accountability mechanisms at the country level, as well as really introduce the concept of independent accountability as well. In terms of where we felt the Commission's report fell short, was in two main areas. One of them was that the Commission was able to recommend fiscal policies for governments and included tobacco and alcohol specifically. It failed to really focus on taxation of sugar-sweetened beverages, which is obviously a good buy recommended by WHO, and many governments are now moving down the road of implementing sugar-sweetened beverage taxes. So we would have liked to have seen a more comprehensive approach to fiscal policies. Secondly, the report fell short in terms of really highlighting the role of unhealthy commodity industries as a bottleneck to the response, which the UN Secretary General's report did very clearly at the end of last year, which is feeding into the high-level meeting as well. We've seen time and time again that unhealthy commodity industries are infiltrating public health organisations. They're subverting the science and the evidence, and they're really interfering in public health policy making. So we would have liked to have seen a much stronger focus on that within the High-Level Commission's report. And I think thirdly, the area that we would have liked to have seen a bit more strengthened, even though it is in there, is the focus on civil society and meaningful involvement. I think over the years, unlike in HIV/AIDS, the concept of meaningful involvement of people living with NCDs and those affected, whether in terms of advocacy, whether in terms of policy development, whether it's in terms of the design of health systems and services and accountability, has been somewhat lacking. So we really wanted to see a stronger focus of that in the High-Level Commission report, and we'll be focusing on that very specifically in the remaining months leading up to the high-level meeting in September. So in terms of those areas that I just mentioned of the weaknesses perhaps of the High-Level Commission report from a civil society perspective, the way that we as civil society will be addressing that in the remaining few months in the lead up to the high-level meeting is really to say that some of these issues we believe will be some of the main challenges actually within the negotiations of the political declaration itself, which are obviously already underway in New York through the government missions there. The way that we're going to really try and ensure that those issues are fully addressed is that we're going to really ensure that civil society as a whole, at global level and regional level, are really united around some very concrete priority recommendations for the political declaration, which we as the NCD Alliance have already put out. In addition, we're going to be doing some very targeted advocacy around those specific issues with governments, and also making sure that we as a community are very aligned in our asks and our advocacy. And then finally, the other way that we're going to be addressing it, which is a bit more of a broader objective of ours for the high-level meeting, but very important for your meeting, is the importance of getting heads of government and heads of state to the meeting itself. In 2011, we had 35 heads of government, heads of state at the high-level meeting, the first NCD high-level meeting at the UN. In 2014, we had 0 heads of government, heads of state there. As the High-Level Commission report highlights, the importance of getting heads of government, heads of state at the highest political level to attend these meetings is a real indicator of leadership around the issues, and to be making sure that we've got buy-in and ownership at the highest political level, which really supports ministries of health in responding to the issues. So that for us as the NCD Alliance is one of our major focuses, to ensure that we have a really good number, and we hope that from the WHO EMRO region we'll be really seeing some very high level attendance from governments at the high level meeting in September. So we at the NCD Alliance always see these UN high-level meetings as really important global milestones in the response. It's an opportunity for governments to be reviewing progress, to be really highlighting and showcasing good practice. What are the specific policies and plans that have been implemented since our last high-level meeting that we can really showcase and incentivise other governments to be doing more. But we also see these high-level meetings as they're not a cliff edge. They are essentially an important milestone in a longer-term response. And so our work is not done at the end of 27th of September, it's really just beginning. And in terms of what civil society will be doing is, we'll be firstly really raising awareness within governments of the commitments that have been made. So a real kind of awareness-raising effort to ensure that all of our alliances in country, including in the WHO EMRO region, are talking to their ministries of health to raise awareness of the commitments made, and to really be understanding how governments will be taking them forward in terms of their next phase of their national NCD plans, for example. Secondly, over the next kind of period of time after the high-level meeting, we'll continue to have a really strong focus on advocacy on the cost-effective interventions for NCDs, because we're seeing more and more governments going down the path of implementing the best buys or the good buys, which are really seeing results in saving lives, and they're being seen as a real investment for governments, particularly now. Thirdly, obviously the UN high-level meeting on NCDs is our big opportunity, but there are many other global health and development forums that we need to be including NCDs in. One example, the following year will be the UN high-level meeting on universal health coverage. So our advocacy is, obviously focused on NCDs specifically, but we also try and integrate NCDs into these other important global health political forums where possible. And then finally, our role as civil society post-September will be around playing the role of the watchdog. We track government's progress, and we really try and ensure that governments are keeping to their promises and ensuring that commitments are made. So we as civil society will be playing a really important partnership role with governments to ensure that those commitments at the UN in New York are then translated back home for the communities that their governments are working for.